Hello everyone, my name is Varun. Welcome to Medica's video podcast again. So we have Dr. Bharadwaj. In the previous videos, you must have observed that we have discussed about some very important topics related to ENT. So in the previous video, we have discussed about sinusitis. How can we quickly get rid of sinusitis? How can we ensure that sinus problems are not reoccurring? And what are the accurate methods to ensure that we get rid of the sinus related problems? In today's discussion, we want to discuss another common problem which most of us really face, and I believe this problem is there in every household, which is acidity or acid reflux. Dr. Bharadwaj, welcome to our session, sir. Namaste.
Thank you. Thank you so much.
Dr. Bharadwaj, this is there in every house, no matter what we say. Of course, there could be a lot of reasons behind it, but we want to understand, Dr. Bharadwaj, what is the difference between acidity, acid reflux, heartburn, and constipation?
Thank you so much for having me, Varun. So these are, of course, as you said, very common problems. Let me start off by saying, by explaining how this whole process works. So basically, this is food and our gastrointestinal tract. And my role as an ENT specialist is definitely there with acid reflux because we see a lot of patients because it causes multiple problems, as we will discuss during this show. As we take food into from our hands into our mouth, there is a process of chewing that happens, which is the voluntary phase. In the voluntary phase, we know exactly how many times to chew and the kind of activities that go on between our tongue, our teeth, and our lips, so that the food is chewed, and then it goes on, and we can finally push the food back into the back of our throat. After this phase, everything that happens becomes involuntary because as soon as you push the throat back, the food back into the back of the throat, the process becomes involuntary. We have no control over it. So then, very, very complex mechanisms start off. First of all, to prevent the food from going into your windpipe. So some critical acts take place to prevent your food from going into the windpipe, and the food is transformed into your esophagus and then goes into the stomach. And in the stomach, the first thing that the food encounters is acid. The acid in the stomach has got major functions to perform. And so we are talking basically about acid in the stomach. And the junction between the stomach and the esophagus is also called the cardia or the gastroesophageal junction, which is usually at an acute angle to prevent stomach contents from seeping back into the esophagus. The esophagus does not handle acid very well because it does not have the kind of mucosa which the stomach has. The stomach mucosa is specially created to handle the acid in it, but the esophagus is very susceptible to acid. Now, when you have acid in the stomach, there is a possibility and sometimes a predilection for patients for that acid to come into the esophagus. This is reflux. So sometimes either acid or food particles coming back from the stomach into the esophagus or the upper aspect of your food channel is reflux. Now, acidity is basically when there is a higher secretion of acid, particularly during times of stress and because of some medication, that is acidity. Reflux is when either this acid or some food particles get transported from the stomach into the esophagus. Constipation, of course, is a different story altogether. It is related to our anus and rectum. It is in the lower gastrointestinal tract and has really nothing much to do with what is happening in the upper gastrointestinal tract.
Thanks for the clarification, Dr. Bharadwaj. See, especially in the recent past few months, most of the people have been having these chest pains, right? And most of these people are ignoring these chest pains, assuming that they could be related to acid reflux or acidity. So, how do one determine if the chest pain is related to acidity, or if it's a heartburn, or if it's an acid reflux, or it's actually a heart attack? There's a lot of we have seen a lot of cases where people just disappeared out of the blue with just a chest pain, Dr. Bharadwaj. How can one differentiate when to immediately go to a doctor, or okay, this is acidity and I'm it's not a heart attack?
Warren, this is a very important question, and this may actually help save lives because this is
Exactly,
actually a
sir.
lot of confusion, and many patients continue to eat their meal in the presence of a heart attack, thinking it is just acidity.
Right,
So
sir.
first of all, you must understand that sometimes it can be so tricky that no clear distinction can be made.
Exactly, sir.
They mimic each other so closely that sometimes, even in spite of knowing the background of a patient, you may go wrong. And so the safety would be to go and have yourself checked out in an emergency, at least get a basic ECG done. Having said
Right.
that, first of all, acid reflux or symptoms related to reflux or acidity are actually, there is a background. First of all, if you're eating a spicy meal or an oily meal or in a restaurant outside, or you are obese and you know that you have overeaten, and there is distension of the stomach, there is gas, and at the same time there is some burning sensation in your mid abdomen, those are symptoms which are more likely to be because of acidity. But if your symptoms are, you are feeling breathless, you have chest pain, if you have a pain going down from the neck down into the shoulder, if you have a previous history of some cardiac problem, if you are an elderly, if you are diabetic, if you have other comorbid conditions like you're on blood thinners or some other medical problem that you have, which indicates that you may have had some cardiac issue in the past, these are indicators that you should not take this kind of chest pain easily. You should, if at least, get a simple ECG done. And of course, because we are always looking for cutting edge technology, this watch currently, like there are now many smart watches which allow you to record an ECG from the comfort of your home by just pressing a button. So if you're in the possession of any such wearable device which can measure your ECG for you, not only do they check your ECG, but they also tell you if there is an ECG abnormality. So not only should you be going and visiting a doctor or a medical facility in an emergency to get your ECG, but if you have a wearable which lets you have a diagnosis or checks out your ECG, that is a starting point. At least there is one way you can start out. In addition to that, if your pulse has become irregular, your pulse has become fast, you're breathless, and you have other symptoms related to a cardiac problem like feeling of heaviness and intense pain in the chest, definitely you should not ignore. Safety is in at least getting an ECG done and showing yourself in an emergency. Let the doctors there rule out if it is a cardiac problem or not.
Right. That's a valuable information, Dr. Bharadwaj. Ladies and gentlemen, how do you differentiate acidity versus heart attacks is something that Dr. Bharadwaj has just explained it to us, the differentiation, when should you go to the emergency room, and how should you actually check ECG with the wearable devices. For those who have missed it, please ensure that you rewind this and make a note of it because this has been a very common and an important life-saving subject for most of the audiences nowadays. Thank you so much, Dr. Bharadwaj, for that. Dr. Bharadwaj, so is there a difference between you just mentioned about the difference between acidity and acid reflux? So a lot of us from the childhood or from the from our ancestors, there are some home remedies they prescribe us, and there are some over the counter medicines that we usually take. Does these medicines that are available over the counter like or any other company for that matter, do they really help in recovering from the acidity?
Well, again, that's a very good point because we need to tell people what they can do at home to improve. So, first of all, Eno is meant for gas because Eno has carbonaceous material or basically aerated water. The aerated water helps if there is gas trapped in your upper abdomen. So, if you have gaseous distension, so if you have a distended abdomen and you feel there's a lot of burping, then Eno works because it helps to absorb all that excess gas and makes you feel slightly lighter. These are safe things for you to take, but you must understand that you cannot take this in the presence. Suppose you're suffering from an attack of acute pancreatitis, these kind of agents and have they may precipitate a more serious episode and you may have a more serious attack of pancreatitis if you take such thing. You have simple things like gels available which are antacid gels. You can take those. You can, the best thing at home you could do is probably take some curd is very good. It is a probiotic,
Okay.
helps not only in the stomach and calms down your stomach, but it also helps to calm down your lower intestine because it is a probiotic. It helps to bring out good germs and good bacteria in your intestine. So curd would be a nice thing to take. During our times, it was recommended that cold milk was a very good remedy for acidity or acid reflux. But that has not really stood the test of time, because at that time, peptic ulcer or duodenal ulcers were called because of class or type A personality, because the hurry, curry, worry kinds, those executives and those who are always out on a job, working very hard, driving themselves to work harder and harder. But then later on, when research said that H. pylori is responsible for these, and it may not be so related to hari kari worry. And then we also realized that sometimes milk may increase acidity. So taking cold milk for acidity may not always be a good idea. If it works for you, we don't have a problem, it's all right. But it hasn't been proven to be very effective for many, many people.
Right, doctor. That's a good input for a quick relief, especially the curd subject that you had mentioned, Dr. Bharadwaj. So, Dr. Bharadwaj, there is again another home remedy which most of the people usually talk about. Lemon separately, Jeera is going to help in acid reflux. So, are these anywhere near to curing or relieving from acid reflux or acidity, Dr. Bharadwaj?
So again, as I said, these are basically natural remedies taken at home. What we find is actually in these instances, ajwain is better. Jeera actually
Okay.
is more of a spice, but ajwain definitely helps to reduce flatulence and abdominal discomfort. And jeera and ajwain taken with warm water has some medicinal properties, and it can be
Okay.
used in the absence of any other medical facility available or any other medication. And as a stopgap, a little bit of ajwain along with warm water can be swallowed to see if you feel better. It is safe. It is not harmful in any manner. It is just a food item in any case. So this can be tried.
That's great input, doctor. So, doctor, see, what I have seen, especially in my friend circle as well as in other case studies that I've been observing online, acid reflux is a very common medical condition, especially in kids, in children, right? So they irritate us, especially in the midnights. They throw up, they cry continuously, and there are instances where we had to take them to the emergency rooms in the midnight as well. What is the suggestion that you're going to provide to the parents to ensure that their kids don't fall prey for this acid reflux? Number one. Number two, in case if they see some signs related to acid reflux, what is that they can instantly do to ensure that their kids are at least calm till the time they find a doctor?
See, in children, the gastroesophageal sphincter is a little straighter, and because they are children, because their diaphragm is not very muscular and not well developed, children have a natural tendency for reflux. Their reflux capacity, and that is why, if you remember, a newborn child has to be burped. So whenever
Oh
a newborn
yes.
child is fed, the first thing you have to do is to burp the child. Why? Because otherwise everything, the whole matter will just come out. And so it starts off at birth. Children at birth are very, very susceptible to reflux. And that is why as soon as they've taken a breastfeed, somebody picks up the child or the mother and walks the child around till the child has burped. What does that mean? That means the gas has come up, the food matter or the milk has gone down, and now the child
Right.
can be put down. So you must understand, children, by the very nature of their anatomy, are more prone to gastroesophageal reflux because their sphincter is not very tight, and because the angle is slightly straighter, so they have a susceptibility.
Right.
The two most important things that we can discuss, and I'm sure you will agree with me. Number one is childhood obesity is on the rise. Obese
Yes
children
sir.
will definitely have much more reflux.
Yes
And
sir.
second is giving them junk food and aerated waters and sodas. Those are a very, very common cause of reflux because they are highly acidic, and they contain a lot of preservatives. They irritate the child's stomach and make them more prone to acidity and reflux. We must avoid giving this to children. Particularly, the problem is in the evening you go out with your child, have a
Yes
pizza,
sir.
and along with a heavy meal of a pizza, which is full of butter and cheese, you add
Yes
on
sir.
some Coke and Pepsi or some other soft drink, and the child also loves to have that. So that by the time the child comes back home, he or she, their stomach is bloated, and the tendency for bringing up is much higher. Avoid a heavy meal, particularly at night. Avoid junk food. Avoid very heavy things like too much of buttery food or fried food. And avoid Cokes and Pepsis or any at least aerated waters which have a high sugar content and are carbonaceous because they are harmful for children.
Right. I mean, that's a wonderful suggestion, Dr. Bharadwaj. Of course, time and again, doctors like you have been repeating this to ensure that kids do not get addicted to these soft drinks, aerated, carbonated waters, junk foods, heavy cheese, and heavy buttery kind of food, especially in the evening times and all. So, Dr. Bharadwaj, is there a timeline that we should finish off our food to avoid these acidity kind of problems or acid reflux kind of problems, Dr. Bharadwaj? What is that timeline that we should maintain?
Generally, it is recommended 2 to 3 hours is ideal. 2 hours is preferable. And so, if the child, sometimes it depends also on the culture that we follow at home. And if children are given into the habit of going to sleep along with their parents, and if the parents are sleeping at 10, 12 o'clock, that's also not healthy for the child. I think the last meal of the child should be given around 7 p.m. And between 8 and 9 p.m., they should be put to bed so that they have a comfortable sleep and at the same time they have digested their meal. The last meal of the day should not be spicy, heavy, fried, and preferably simple, healthy home food, which is nutritious for the child.
Great. So is this the same applicable for the adults also, Dr. Bharadwaj, to ensure that tomorrow morning I don't get up with a lot of acidity, I can't go to office, my stomach is paining, I need to take a day off, etc.?
Exactly the same advice for adults.
Okay, okay, great, wonderful. So, ladies and gentlemen, we just discussed and reviewed about this acidity related problems and acid refluxes. We'll ask one more question. The most common medicine that everyone is usually taking in the early morning times, even before breakfast or even a coffee, is a medicine called Pantop. It comes with various, chemical compositions. Dr. Bharadwaj, taking these Pantops on a regular basis, is this suggested? How do we avoid taking these Pantops and ensure that we completely get cured from acidity, Dr. Bharadwaj?
So, it is unfortunate that in this country, drug regulations are so poorly maintained that patients can take these medications without a prescription, which is
Yes.
actually what is required because these are PPIs. PPIs are proton pump inhibitors and they have long term side effects and complications. Unfortunately,
Okay.
patients have a habit of taking them on their own for years together, which is very, very harmful. And I'll tell you three things which are harmful for them. Number one is it prevents them from accepting good nutrients from their diet. It prevents you from absorbing certain nutrients in your diet, which makes you more prone for nutritional deficiencies. Second is it makes your bones weaker. So, particularly for the elderly, they already have a problem of osteoporosis. And if you take a long term PPI, it can cause more of a problem. And thirdly, it does cause issues with pneumonia. So if you get a pneumonia and you're on a PPI, it becomes very difficult for doctors and the ICU team to treat that pneumonia, community acquired pneumonias. So PPIs without medical prescription, PPIs or drugs like you're mentioning to take for long periods are extremely harmful. I will advise strongly against it, and they should rather depend upon diet control, regular physical activity, and some home remedy, whichever works for them, rather than depending upon such medication, and especially not taking them on their own.
My goodness, it's alarming actually, doctor, because most of them doesn't know it. I mean, as you rightly said, as these medicines are available just over the counter, and we just go to a druggist or a chemist, to pay and take them, and they continue to take it. So I believe, correct me if I'm wrong, Doctor Bharadwaj. So especially doctors would suggest these Pantop kind of medicines, especially when they are taking these antibiotics. And I believe once the course is done, you should stop taking these kinds of Pantops in the mornings, and you should not continue to do that. Am I correct, Dr. Bharadwaj?
So that is also a bit of a misinformation. Actually, most antibiotics do not cause acidity.
Okay.
Antibiotics cause drug-related diarrhea because they seep out the good gut from your bacteria, and that
Okay.
relates to loose motions and sometimes infections by some very dangerous bacteria like C. difficile. So, what you need to take or should take or would be advised to take is good probiotic agents along with the antibacterial. It is drugs like anti-inflammatory drugs like ibuprofen or diclofenac which cause acidity, and that too you should not take presuming that you will get acidity. You should only take
Right.
as and when you have a symptom related to it. For instance, I prescribe most of my patients will go away with an anti-inflammatory if they have some pain or inflammation, may take an antibiotic if they have a bacterial disease which requires antibiotic usage, but no anti-acid is prescribed for them unless and until they tell me that they have an acidity issue, or they ring me up in 1 or 2 or 3 days to say I'm having some acidity, in which case it may be given to them for a short-term period. It is not required, especially for an antibiotic, and antacid or a PPI is completely not required.
Great, great. Thanks for that advice, Dr. Bharadwaj. Lastly, for our audience, Dr. Bharadwaj, what would you like to suggest for those people who are suffering with this acidity or acid reflux for a very long time, so that they can follow your guidance and they can take the precautionary measures, whatever you suggest?
One of the simple things they should do. Number one, bring your weight down,
Okay.
because obesity reduces the musculature of your diaphragm. It makes it more easy for reflux to happen, and you will suffer from consequences of um, acidity, reflux, and you may also have a hiatus hernia, which then becomes a surgical problem and it may require a surgery also. Number
Okay.
two, physical fitness. Make sure that your diaphragm is in a good shape. So, jogging, running, aerobic activities, and other exercises to keep your muscular tone in good shape is very important, because that helps you in the long run. Also helps to bring down your weight. Number three, avoid heavy meals, particularly the last meal of the day should not be very heavy. Number four, the last meal of the day should be at least 2 to 3 hours before you go to sleep. The next is, if you have a predilection for, you are obese, or you have a very poor gastroesophageal tone, in which case make sure that the head end of your bed is slightly higher than
Okay.
the tail end or than the foot end, so that the force of gravity does not push all the stomach contents into the throat, and you remain safer in that manner. Avoid aerated waters. Avoid drinking alcohol at night, because alcohol increases acidity and also
Okay.
relaxes your muscles, so that the blood flow to your brain is slightly easier. The next thing for us to remember is that cigarette smoking and alcohol both promote acidity and will promote acid reflux, and so we must avoid smoking and alcohol, because they are definitely involved in increasing our acid reflux. The simple method for people, particularly if you're obese and your gastroesophageal sphincter is weak, or if you have hiatus hernia, a simple thing to do is to elevate the head end of your bed and keep the
Okay.
leg end or the foot end slightly lower, in which case the effect of gravity is not felt and you're able to sleep more comfortably without increasing your reflux. So these are simple things we can follow at home to make sure that we remain reflux and acidity free. And if there is a problem, one must definitely consult our specialist.
Great. Thank you very much, Dr. Bharadwaj, because you actually have cleared a lot of myths and a lot of misconceptions we have around this acidity, acid reflux, constipation, especially differentiation between a heart attack or a chest burn and the acidity, Dr. Bharadwaj. So your inputs are definitely more valuable for those people who are suffering and who have been having this long-term acidity and acid reflux related problems, Dr. Bharadwaj. Ladies and gentlemen, if you require to connect with Dr. Bharadwaj, find him on www.medicasapp.com. You can also download Medica's mobile application from Play Store or App Store. You can find that in the scroller at the bottom. And you can find Dr. Bharadwaj. He is based out of Delhi. And whoever is in and around Delhi, you can visit this hospital, which is Met First ENT Center. So he is available there, and you can have a direct consultation with him. For those who are away and cannot go to Delhi, you can find him on Medica's platform, and you can have an online consultation with him. Dr. Bharadwaj, thank you so much, sir, for your time. And
Thank you, sir.
you have been a great help to the society, especially when it comes to various medical conditions.
Thank you
Namaste,
so
sir.
much. Thank you. Thank you.
Thank